Hello, my name is Melissa Cowles, ADN RN. I'm a student of the Baccalaureate of Science program at Lamar University. Currently, I'm in the nursing 4580 Synthesis of Professional Nursing course. This is my capstone and 5-year plan. I graduated from Texas A&M University at College Station with my BS in zoology in 2001. Then I continued my education with an ADN from San Antonio Community College of Nursing in 2004. Now I plan to graduate from Lamar University with my BSN. My professional background was that I was a staff nurse at the Kidney, Liver, and Transplant Unit at Methodist Specialty and Transplant Hospital from 2004 to 2006. Then I went to be a staff nurse and charge nurse at the Hematology Oncology Bone Marrow Transplant Unit at Methodist Children's Hospital from 2007 to 2009. Then I went to their outpatient clinic and became a staff bone marrow transplant nurse at Children's Cancer and Blood Center at Methodist Children's Hospital from 2009 to 2014. Then from there, from 2014 to present, I've been substituting as a school nurse in the Bernie ISD area. I'm a member of the American Nurses Association and the Texas Nurses Association. My certifications are PALS and BLS. Now I'll talk about my capstone presentation and how I met the baccalaureate degree student learning outcomes. For the Humanity and Society, learning objective number 1, practices safe and effective holistic patient-centered care to a variety of patient clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I met this outcome through Nursing 4540, Practice Care of Communities. The assignment was the community-based service learning, civic pride and diversity initiatives, in which I researched about a local nonprofit organization. This project gave me a better understanding of a different subset of the population and how being involved in a nonprofit organization can help care for people outside the traditional nursing setting. This also helps me to understand how to carry over my knowledge of nursing theories and evidence-based practices into the community. The goal met was 97%. For the lifespan health continuum, learning objective number 2 supports patient clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death and dignity. I met this outcome through Nursing 4316, Comprehensive Holistic Health Assessment. The assignment was discussions 1 through 4. These discussions about simulated patient scenarios allowed me to research and give supporting evidence that promoted their health and well-being, and also how to educate the patients about preventing disease. The goal met was 96%. Learning objective number 3 evaluates patient-centered care for clients across a lifespan based on common and complex health needs and compromised health states when considering multiple determinants of health. I met this outcome through Nursing 4620, the nursing practice care of patients with compromised health states, multiple health states. The assignment was Practicum Reflection 3. This paper allowed me to interview a real patient and get to know their history on a personal level and find out what their needs were. I also developed a plan with measurable goal and educated the patient on how to reach this goal. The goal met was 94.9%. In the evidence-based practice and clinical reasoning, learning objective number 4 synthesizes clinical and judgment in nursing practice, utilizes critical thinking, nursing process, research, and evidence-based practice. I met this outcome with Nursing 4391, evidence-based practice and nursing inquiry. The assignment was discussion 2, qualitative research study. This discussion was on a research article on nursing attrition, and it helps me to understand how to examine what makes for a good study article. It made me use critical thinking to show how this article may and may not apply with my nursing process. The goal met was 95%. Patient client-centered care, learning objective number 5, employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patient clients and members of the interprofessional and intraprofessional healthcare team. The outcome was met with Nursing 4321, Nursing Theories and Online Education. The assignment was Focused Insight essay questions. The essay questions focused on using nursing theorists and their models and how I use them in my practice. I also had to discuss how the nursing theories apply to patient-centered care and how the theories influence my healthcare team. The goal met was 92%. Professional roles, learning objective number 6, differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients, clients as a member of the interprofessional and intraprofessional healthcare team. I met this outcome with Nursing 4550, Practice Leadership Management Healthcare System. The assignment was discussions 1 through 4. These discussions allowed me to understand problems with regulatory parameters that affect the work culture and patient care. I was able to research and think of ways to deal with them using evidence-based interventions to change the interprofessional and intraprofessional environments of the healthcare team. The goal met was 95%. Learning objective number 7 demonstrates professional integrity, effective communication, active inquiry, and service to the community. I met this outcome through Nursing 4540, Practice Care of Communities. The assignment was the practicum assignment number 3, Project Teaching Plan. This project allowed me to research the issue of a disaster preparedness planning for my community and also develop a teaching plan and provide resources for the community. The goal met was 95%. For my 5-year plan, I plan to graduate from Lamar University with my BSN in this year, in 2019. And then in 2020, my plan is goal is to learn and become fluent in Spanish so that it can assist me in caring for Spanish-speaking patients only. Living in the San Antonio area would greatly help my chances with giving the best care. Also in 2020, my goal is to obtain a certified pediatric nurse, or my CPN, and then also renew my PALS and BLS. In 2021, my goal is to prepare and get hired onto a new nursing career, be an active part of the nursing staff by advocating for evidence-based changes. In 2020, my goal is to join another accredited nursing organization to help further my nursing career. In 2023, I would like to prepare and apply for an MSN program. Thank you for listening to my presentation.